Hello, I'm Chini from MSK MRI.
Today, we will discuss MRI findings in Grade 3 medial collateral ligament and clinical relevance of medial patellofemoral ligament injuries. The superficial medial collateral ligament attaches proximally near the medial epicondyle. We can observe a complete discontinuity of the proximal superficial MCL and adjacent soft tissue edema, indicating a full-thickness tear of the superficial MCL. At the tear site, we do not see the normally visible MCL. Instead, on a more distal axial image, we notice a thickening of the MCL. Diagnosing a Grade 3 injury of the superficial MCL is relatively straightforward based on these findings. Injuries of the superficial MCL can propagate both anteriorly or posteriorly to involve the anterior medial patellofemoral ligament or posterior oblique ligament of the medial supporting structures. I will mention the posterior oblique ligament injury next time. For this session, I would like to discuss the clinical relevance of medial patellofemoral ligament MRI abnormalities in the setting of MCL injuries. The medial patellofemoral ligament merges with the fibers of the medial collateral ligament at the epicondyle. Therefore, the medial patellofemoral ligament appears abnormal in most patients with clinically and MRI-documented cases of superficial MCL sprains or tears at or above the knee joint line. The femoral third of the oblique decussation component of the medial patellofemoral ligament, which arises from the anterior margin of the upper superficial MCL, appears abnormal in approximately 90% of cases involving superficial MCL injuries. However, despite these medial patellofemoral ligament abnormalities, these cases showed no evidence of concurrent lateral patellar dislocation on the initial MRI scans. Let's briefly review the anatomy of the medial patellofemoral ligament. The medial patellofemoral ligament will be covered in more detail in Chapter 4. The medial patellofemoral ligament consists of a thinner, more superior transverse component attaching to the medial femoral condyle and a broader, more inferior oblique decussation component arising from the upper segment of the superficial MCL. This pink structure represents the oblique decussation fibers of the medial patellofemoral ligament. Compared to normal, there is a Grade 3 tear at the proximal attachment site of the medial collateral ligament. We can also see the oblique decussation component of the medial patellofemoral ligament, which exhibits partial tearing of the femoral and mid-thirds. Thank you for watching. If you found this video helpful, please like it.